Hello viewers, welcome to Bells TV and also you're welcome to Health Matters. I'm your honorable host Faith Martins. I apologize for not bringing you this Health Matters for the past few months now. It's due to some kind of inconveniences, but we promise you that by the grace of God we'll be bringing you our new topics starting from today on. Will be current on our Health Matters. Our topic that we'll be treating for today is a popular topic known as diabetes. But I promise you guys at the end of this topic, even though it's a popular topic, is a popular sickness that we normally hear from people or we normally see people that have it. At the end of this program, we should be able to know more about the deep things that we were not really aware of about this topic. We'll be starting from the definition normally the way we do before we're going into the subtopics. We'll know what it means. Now, diabetes can be defined as a group of metabolic diseases in which a person has a high blood insulin, and this can be due to inadequate insulin, or maybe the cells that are responsible to produce this insulin, they are no longer in the normal cells. Okay, and we'll have different types of diabetes. We will list the three of them and I will explain it, but we're rushing it because of time. The number one type of diabetes is type 1 diabetes, and this type 1 diabetes is a chronic condition in which the insulin that is being produced in the body is little or it is insufficient. And when this insulin in the body is insufficient, this is where diabetes comes in. And we also have another type of diabetes which is known as the type 2 diabetes. It is also a condition in which the way the body processes the blood sugar, that is the glucose that will take through the food we eat, the glucose that is in the food we eat. If your body is not in a normal situation to process the sugar, and it accumulates, it also leads to diabetes. But this is another type of diabetes. The last type of diabetes we have here is what we call the gestational diabetes, and this is commonly found in pregnant women because of change of diet. Now we're moving into the symptoms. What are the symptoms of diabetes? Patients with diabetes, they normally experience what is known as the polyuria. To break it down, they experience what is known as the frequent urination. You can see a diabetes mellitus patient can urinate within an interval of even 1 minute. The person has urinated 3 times. That is commonly seen in patients with diabetes. And also we have what is known as the polyphagia. This polyphagia is known as intense, as in the person can, the person feels hungry easily. Maybe the person can eat more than what is supposed to eat if the person does not have this kind of disease. And another symptom that can experience is intense thirst. They'll feel thirsty all the time. They drink water, drink and all of that. And then also they can have cuts and bruises which do not heal on time, because if you see a diabetic patient with a wound, it takes time before the wound will heal because of that because of that disease in their body. And the subtopic we'll be treating inside this diabetes is the complications. Diabetes has common complications that it causes in the patient, which include, we have the food complications, we have the foot complications, we also have the skin infections. You can see a diabetic patient with some kind of skin infections like skin rash and all that. And it can also cause what is known as stroke. A diabetic patient is prone to stroke, because diabetes and stroke, I can say they are on the same line. Yes. And the last subtopic which we have here for today's program is the treatment. For those that already have the diabetes, what are the ways which you can use to treat it? The number one method is using what we call the oral hypoglycemia drugs, which include the glucophage. If you go to the hospital and they found that you have diabetes, this is a kind of drug that will be prescribed for you, this oral hypoglycemia, which includes this glucophage. And another type of prescription of drug is the insulin injection. Like you can see, the diabetic patients, they normally go for insulin injection because of the insufficient insulin in their body. So they will take this insulin injection to be added to the one in their body, so that glucose can be broken down for them to live long. And another type of treatment which we have here is what we call the glycosomes. All these are methods which you can use to eliminate or maybe sustain a diabetic patient. And from here, we'll be coming to the end of today's program. Keep watching Bros TV and keep watching Health Matters. I'll still remain your honorable host, Faith Martins. Thank you.
This message is from your #1 online TV, Bros.